See, first thing is how to hold the spleen in anatomical position. So see, over here, always hold the spleen on the left hand. Don't do this. People usually get it wrong. To hold it right hand. And see, if you put the spleen like this, the convexity will be should be in your left palm. Okay. And here, the hilum should be medial. See this bunch of structures. Can you find this bunch of structures? The bunch of structures are at the hilum. Okay. So the hilum should always be medial. And now mark one thing. Always see how to know the upper border, because the upper border should be towards the upper end. That tells you how to hold the spleen in position. Now see over here, how to know the upper border. This is splenic notch. See in this specimen, there is a splenic notch here. See what I am showing. There is a notch here. You can find. All of you can see what I am pointing with my right finger, right hand. There is splenic notch over here. See there is splenic notch over here. See there is notch over here. And also over here you can find a notch. So now the dilemma is with the upper border. Because ideally in most cases, on the upper border has got the splenic notch. So two things are there. First, the border which is taken as upper should have a notch in it. Second, the impression that bears the hilum should be evoked. Okay, so you see over here, if you hold the spleen like this, see this impression, this impression holds the hilum because of the structures present in the hilum are here. So that should be evoked with the notch on the upper border. So ideally this is the position, anatomical position, this spleen. So two criteria should be satisfied. First thing, the upper border should have notch. In case both upper and lower border have notch, then see the upper impression. The upper impression should be evoked and should be having the hilum with them. Okay, so this is the anatomical position of the spleen. Then the very next question is, what are its parts? There are two ends, posterior and anterior end. Okay, some call it medial and lateral end. See, if you hold the spleen in position, hold like your hand with your hand dorsiflex like this. Okay, don't hold it like this or this. Hold it with the wrist being dorsiflex. Okay, so like this. Okay, so what are the parts here? Upper border, intermediate border, lower border. Some books only define two borders, upper border, lower border. Then the convexity that fits in the palm is the diaphragmatic surface, and the opposite surface distal surface. Then they ask what are the impressions on distal surface. This is gastric area above, renal area below. This is hilum, in front of the hilum. Yes, there is pancreatic area, and in front of that colic. Okay, so if you see from forwards to back, first the colic area and a very little impression here is pancreatic area. Okay, then what they ask in the spleen is, which ribs are related to spleen? They are 9, 10th, 11th rib on the left. Always mention the side. Left 9, 10th, 11th rib, and which is the axis? 10th. Left 10th rib is the axis of spleen. Then the after ligament, that is gastrosplenic, radiolinic, then phrenico-colic and phrenico-splenic. But they ask here, what are the contents of gastrosplenic ligament or what are the contents of lineorenal ligament? Okay, contents of gastrosplenic ligament are short gastric vessels and left gastroepiploic vessel. Remember that, okay? And contents of lineorenal ligament are tail of pancreas and splenic vessels. Tail of pancreas, splenic vessels. Have these two contents in mind. That is often asked. Then they may ask which is the suspension. That is obviously phrenico-splenic ligament, because phrenic diaphragm, that is between the diaphragm and the spleen below. So that is phrenico-splenic ligament. Or they ask which is the sustentaculum lineus. Lion means spleen, sustentaculum means support. The phrenico-colic ligament, the name phrenico-colic, because it attached between left colic flexion and the diaphragm. That is supporting the spleen from below, just like this. Okay. So over here, what you see? That phrenico-colic ligament is called sustentaculum lineus. Okay. So this is the usual thing. Then see, sometimes they ask questions very obvious. So if they are asking a viscera, they will definitely ask about artery and vein. That artery branch of which artery, what that vein drains into which vein. These are the basic questions. Go beyond that. Suppose you answer all this instead. Then they ask where it's developed in a dorsal It is only mesodermal in origin, that is just from which terminal it develops. Or sometimes they might, if you answer all this, say what is red pulp, what is white pulp, what is composition of red pulp, what is composition of white pulp, like that. Okay. Then the next viscera, that in this spleen, there is no confusion because you can find a clear notch only here. So you can call this notch at the upper border, and if you tell this condition, you can see that the upper impression is larger and with the hilum. So there is no confusion here. Most of the spleen like that. You find the notched border, that should be upper border, and here you see the upper impression has got the hilum, and that is the larger impression out of the upper and lower impression on the visual surface. So there is no confusion here. Okay. Now let us see what about the kidneys. Kidneys, the thing is, you should be able to tell what is the side of kidney. If it is a window, it can be window question, it can be spotty. So if you make the side wrong there, then nobody asks you anything. So first identify which is the ureter. See, in this kidney it's the hilum definitely, okay, and this is the ureter. So the ureter is the structure that goes down. See, out of this you can find here three things clearly, okay. Okay, now out of that, the thing that goes down at the hilum is the ureter, and the ureter should be the posterior most structure at the hilum. See, they often ask a question, what are the structures at the hilum kidney? That is VAU, renal vein, renal artery, ureter, some call it pelvis, because the part of the ureter of the lower wall of kidney is called as pelvis. Okay, so either you remember VAU or VAP accordingly. Okay, so if I am holding this kidney, see, first thing here, as you can find, the hilum should be medial. Okay, and at the hilum, the ureter, the structure goes down, should be posterior most. So if I am holding this kidney on the right side, observe this structure going down is the ureter, that is posterior most. Okay, that is right kidney. If I force it on the left side, again hilum is medial. Okay, but see the structure that goes down, ureter, is becoming anterior most. See, so this is the wrong side. So this is the right kidney. Okay, and then if you see this kidney, see again here you can find in the hilum these three things. Okay, so here you can find the three things, vein, artery, ureter, and against the ureter that is going down. And if I hold it on the right side, see the ureter is becoming posterior most. This correct side is right side. If I make it this what happens, ureter is become anterior. So this is the wrong side. Okay. And if you see the other kidney over here, they have provided us three right kidneys. Okay. Okay. Left one is not here. Anyhow. Right. So the left one is not here. So all three are or no. So what you remember as the first initial question in the kidney window or in the asked in grand fiber, what are the parts? Parts are two poles, upper low, two borders, medial lateral. Medial border has got the hilum. They often ask the next question, what is structure of the hilum? VAU, tell anterior to posterior. Okay. Then what is short space, anterior surface, posterior surface? Then they ask what are the impressions there. Okay. So see on the anterior surface, on the right side, it is here for the suprarenal gland, this is for duodenum, this is hepatic area, then inside jejunum, outside colon. What is behind? Upper part, there is your the diaphragm with the rib. See on the right side, it is only 12 thread. Okay, because the liver is there that pushes the kidney a bit below. But on the left side, it is both 11 and 12 because the liver is minimum there, so the kidney is at a higher position. Then the lower part of posterior part surface of kidney, you get three muscles, PQT, from medial to lateral side. Psoas major, quadratus lumborum, quadratus lumborum, transversus abdominis, on the quadratus lumborum, what you get, subcostal vessels are nerve, above, then iliohypogastric nerve, then ilioinguinal nerve. The upper structure is both vessel and nerve, the lower two are only nerve. So subcostal vessels are nerve, but iliohypogastric nerve, ilioinguinal nerve. So this is the basic part they asked to show. Then in kidney they can ask a lot of other questions. They can go for the histology, okay, or they can ask the development not yet covered. Nobody is going to ask it, but sometimes the student asks out of habit, but ignore that, okay, because development is yet not covered. And then in the kidney they ask another thing, that is your renal arterial segment. That is your renal arterial segment. So read that in your book. What is renal arterial segment? That is often asked, okay.